Secretary Tillerson, thank you for being here. I'm sorry that I missed you this morning at the Foreign Relations Committee because I was at another appropriations subcommittee hearing. But I wanted to ask you about recent news reports that have described a proposed trip to St. Petersburg by Undersecretary Tom Shannon that's going to happen on June 23rd. And news reports have suggested that the purpose of the trip is to try and discuss with the Russians how we might be able to work together against ISIS in Syria. And last week, a State Department spokesperson admitted that one of the things that will be part of the conversation are the 2 DACAs that were seized last year in response to Russia's interference in our elections. And I have a picture of those there, and we can see that they are quite substantial. It's my understanding that one of the intelligence reports suggested that these were used for collecting intelligence by the Russians. And I wonder if you could share with us, given Russia's continued behavior, why we would even consider the return of those 2 DACAs as part of any discussions that we're having with them.
Well, let me describe to you the nature of our current dialogues with Russia. Good. Because they're occurring at a couple of levels. On what I would call the strategic big issues, like can we work together in Syria? How are we going to resolve the Ukraine? How are we going to deal with cyber interference? Those are being today conducted at my level with my counterpart, the foreign minister, and on occasion with access to the Kremlin. What we have agreed to do, there is a long list of what the Russians call them irritants, we call them the smalls on our side, a long list of things that have been problematic between both of us for some time, and in some cases they're just getting worse. You'll recall when I made my trip to Moscow to see my counterpart, Foreign Minister Lavrov, and had a 2-hour meeting with President Putin. I came out of those meetings and I said, you know, our relationship is at the lowest level it's been since the Cold War, and it is spiraling down. And I said, the 2 greatest nuclear powers in the world cannot have this kind of a relationship. We have to stabilize it, and we have to start finding a way back. So we segmented the big issues from this list of what I call the irritants. The Dachas are on that list. We have things on the list, such as trying to get the permits for our consular office in St. Petersburg. We've got issues with harassment of our embassy employees in Moscow. We have a list of things. They have a list of things. I don't want to suggest to you this is some kind of a bartering deal. It's more, let's start working on some of the smalls and see if we can solve them. As to the Dachas, these 2 properties have been in ownership of the Russians dating back to the Soviet Union, 1971. They've owned these properties and have used these properties for a very long time. They were transferred to the Russian Federation government for $1 at the breakup of the Soviet Union. We have continued to allow them to use these properties. And they have used these properties continuously for all that time. President Obama, in response to the interference with the election, expelled the 35 Russian diplomats and seized these 2 properties. What we're working through with them in this conversation is, under what terms and conditions would we allow them to access the properties again for recreational purposes? We've not taken the properties from them; they still belong to them. So we're not going to seize properties that are theirs and remove their. But we are talking about under what conditions would we allow you to use them for recreational purposes, which is what they have asked. And we have things on our side that we're discussing terms and conditions with them as well. So this is part of how do we take some of the irritants out of the relationship and stabilize things.
And I don't mean to interrupt, but my time is running, and I wonder if you could tell me, if the properties are returned, how we would ensure that they would not be used for intelligence gathering purposes.
That's part of the terms and conditions we're discussing with them, because we've been pretty clear to them, we know what you were doing there. We're not going to allow you to continue to do that.
Thank you. As the Chair Graham pointed out, the 2018 budget proposal would reduce $1 billion from the PEPFAR program. And there are other policy decisions that the State Department is making that will have an impact on PEPFAR in addition to the funding reduction. As you know, the State Department in May released guidelines for the implementation of the Mexico City policy, or the global gag rule, which for the first time ever will apply to all global health assistance programs, including PEPFAR. Now, study after study has shown that integrating reproductive health and HIV treatment and prevention services into basic primary care services leads to better health outcomes and significant cost savings of foreign dollars. And yet, the State Department in this budget proposes eliminating all funds for family planning. So how will the State Department continue to move towards integrating HIV and reproductive health and family planning in light of the drastic cuts that are being proposed to reproductive health funding and the restrictions that you are imposing by the global gag rule?
Well, first, just to be clear, the reduction to PEPFAR is $1 billion, as was pointed out earlier.
No, I understood that. It's the money for the family
right.
planning also has been cut.
The extension of the Mexico City policy to all areas of health delivery was directed under presidential executive order. And so the State Department, when we received the executive order, began immediately to work with all of the delivery services, including all of those in PEPFAR and a number of the other NGO organizations and important partners in the health delivery networks across the world. Our assessment, we believe, is that the impact on those service providers is going to be minimal. That is what we believe. We're hearing from them, but to monitor that carefully, I have said that we will have a report to me after 6 months of how is this working, what has been the impact. And we've been directly engaged with a number of the major private donors, like the Gates Foundation and others, clearly working with them to say, let us know how this is impeding your ability to deliver on the other parts of the health mandate that we still strongly support. So, you know, we're obligated to implement the presidential executive order. We think we found a way to do that, achieve his directive, but do it in a way that has minimal impact on our ability to deliver and minimal impact on our ability to deliver funding to PEPFAR and other related programs. And we will see how that works after about 6 months of operation.
And if I could just follow up, Mr. Chairman, how do you define minimum impact? Because based on information that I've seen from other international sources, losing access to family planning services will result in 2 million more unsafe abortions, 12,000 maternal deaths, and 6 million more unintended pregnancies. So will you factor that in as you're looking at the impact of this policy on the PEPFAR program?
We will factor in those elements that are covered by the President's executive order to ensure that we are implementing the order and we are understanding whether it's impacting parts of our health programs that we did not intend by the executive order to impact.
So you're comfortable with it impacting women's health in the way I've just defined? That's a question. We will carry it out consistent with the President's executive order. So if certain activities and programs are excluded because of the order, we have to exclude those. Well, Mr. Chairman, I'm certainly not comfortable with that kind of impact on women's health worldwide.